Good afternoon, everybody. My name is Dr. Chris Bird. I'm here on behalf of the Coastal Bend COVID-19 Task Force, and we're here to bring you your weekly update on the pandemic. Just to remind everybody, the task force has two objectives. The first is to address your concerns and questions about COVID-19 and the interventions taking place. The second is to enable evidence-based decision-making on behalf of our local leaders. There are several interventions that are taking place right now to control the spread of COVID. Number one is people are getting vaccinated. Two, people are encouraged to stay at home if they can, wear face coverings, especially KN95 masks, or double up on a surgical and a cotton mask to get the highest protection while allowing N95 masks to be used by our healthcare professionals. You're encouraged to continue social distancing. You want to isolate when you're exposed or symptomatic. And symptomatic means that you feel like you have a cold. It can be very minor symptoms, but you could still be contagious. Schooling has been partial to all remote for quite a while now, and businesses are in 75% capacity in terms of open Texas, and what that means is that businesses are supposed to be regulating the customers on their floors to 75% of their capacity. So that's everything that's taking place right now on nuesisnose.com. They have a risk dashboard which says we're in a code red situation with extreme risk of contracting COVID, despite the declines we've seen over the past week or two. It shows you exactly how high we were in terms of having COVID running pretty rampant in our community. So, getting into the cases, there have been 40,563 total confirmed cases. A case is confirmed if you test positive with a PCR test, or if you test positive with another test and have that combined with a diagnosis by a clinician, then you're classified as a confirmed case. Of those, there have been 38,220 recoveries, and there are presently 1,229 active cases. That's down 33% from the last time we gave a report last Friday. So we're moving in the right direction for sure. We can see that sustained decline in the active number of cases of COVID in the Coastal Bend. And these are confirmed cases. Not everybody's getting tested. Not everybody ends up getting classified as confirmed that actually has COVID. So realize this isn't the actual number of cases. It's just the number that we're tracking. The transmission rate is something that we've been tracking and estimating since we started back in April. And the transmission rate is simply how many additional people contract COVID in the next cycle of infections per person. So when it's 1, that means COVID's staying steady. We're right now below 1. Ignore this kind of spread that's occurring over here. I think we kind of broke the model with some of the data that's being pumped into it right now. This should just be a flat line that slowly declines. And right now we're at the lowest transmission rate we've seen in a long time. I can't remember the last time we saw a transmission rate of 0.63. That's what fits our data the best right now. And so that's our estimate for the transmission rates. What that means is that on average, for every 10 people that contract COVID, an additional 6 people are infected. Or in every 100 people that contract COVID, an additional 63 people are infected. If you iterate that out through time, you get a decline in COVID in the community. And that's exactly what we've been seeing. The dots here represent the number of confirmed COVID cases per day. You can see in the past week they've been trending downwards. The orange line is our model projection through those points. And you can see we're projecting a continued decrease after today in the number of COVID cases. I will say that there is a little bit of a caveat here, and I'm not 100% sure how last week's deep freeze affected the data pipeline for COVID. And there might be some bit of depression in these numbers that were caused by people not seeking to get tested or the data getting held up in various places while businesses didn't have power. And so we'll see within the next 5 days if there's any additional numbers of cases. But if you see a large number of cases on one day and it's just a big increase over the previous day, I'd say that's most likely a data backlog that is getting dropped. Zooming in on the coastal bend counties, in purple here we have Nueces County. You can see that there is a sustained downward trend, maybe a leveling off here at the bottom. The smoother that we're using really can't do flat lines. It has to curve in one direction or another. So I'd interpret this as a leveling off at a very low number of new cases per day. You can see other counties have gone down, but there's a couple of counties that are increasing slightly. Let's zoom in on those. So we've removed Nueces and now we're just focused in on the other 11 counties in the coastal bend. Here you can see San Patricio and B have plummeted in terms of their new COVID cases, which is a good thing. But there are a few places where the number of cases have increased in the past week. We've got Jim Wells, Live Oak, and then maybe to a lesser extent Aransas and Refugio. And we'll see if this trend continues or if it's kind of a blip on the radar, and maybe these increases could be driven by backlog cases. We will confirm that as the new cases come in. Zooming out to South Texas, these are metro areas in South Texas, and the scale at which the smoother is tracking is zoomed out also in terms of time. We're going from last May through the present. You can see at this scale all of the metro areas in South Texas are trending downwards in terms of their new COVID cases per day per 100,000 people. This puts it on a level playing field across these disparate counties with differing numbers of people. So there's been a continued decline overall. Looking at the whole state of Texas, these are the public health regions in Texas, and you can see all of them are declining. And again, we're going from back in June or even May up through the present day, and we're seeing a sustained decline across Texas. And if you read any newspapers recently or any websites or news services, I think you've seen that not only is this happening in Texas, it's happening across the country and it's happening across the world. So right now, COVID-19 is in decline across the world, and hopefully that continues. Moving on to hospitalizations. So the dots on this graph, the black dots, represent the number of patients that are in the hospitals in the coastal bend that have COVID-19 on any one day. So each day they count up the number of patients, and a certain number of those patients have COVID. That's what each one of these dots represents. And in orange we have the projection. Now the projection's been fitting pretty well, but very recently in the last week, week and a half, the projection is undershooting the number of actual people that are in the hospital with COVID. And I suspect that this is what I would see if there's been a bottleneck in the number of people getting tested, or in the reporting of data back out to the public. We would see a result like this because the model is calibrated to the new cases per day, and the hospitalizations are then inferred through the dynamics of the model, and it's been fitting pretty well up until the past week. So I suspect that maybe we're going to see a day or two in the future where we have a data drop, and there will be more cases, and the projection will maybe come more in line with the data. Okay, moving on to the percentage of people, the percentage of staffed beds that have patients that are COVID positive in the coastal bend hospitals. The reason why we track this is because this is the statistic that the state uses to determine whether businesses need to roll back to 50% occupancy from the present 75% occupancy that we're seeing now. When this number goes above 15% for 7 days in a row, then we would see that rollback. Fortunately, This number's been declining, and we're nowhere near 15% right now. Only 8.2% of staffed beds have COVID patients in them, and so we don't expect there to be any change in business occupancy based upon the present orders that are in place. Looking at the ICUs, this is from the Coastal Bend. The red represents the number of COVID patients in the ICU, where there's 40 COVID patients on February 24th, which is the last data that I've received, and there were 151 non-COVID patients in the ICU. We can look at this data across the state, and this is February 24th, not February 17th, and you'll see across the state that there's a decline or holding steady pattern of patients in the ICU that are COVID positive. Here's the Coastal Bend figure, and we can move on to just on February 24th again. It's February 24th, not February 17th. I think that this figure is really good at conveying how much pressure the ICU is experiencing due to COVID patients, or how much disruption. And when you see more red, that's the COVID patients, then there's more disruption. So El Paso is one of the most disrupted ICUs, or the ICUs in El Paso are among the most disrupted by COVID in the state, followed closely by Midland and Odessa, Laredo, and Victoria. Here in the Coastal Bend, we're faring fairly well comparatively, and overall, most of these numbers of COVID patients are down across the whole state. Okay, moving on to fatalities. The black dots are the number of reported fatalities per day. I want to remind you that these data come from the state. So what happens is death certificates are submitted to the state, and the state independently verifies how many people have their primary cause of death being COVID. That usually takes 14 days before the data is complete, but given the events of the past week and a half, 2 weeks, it may take longer, and that could be a reason why the number of observed fatalities are dropping below the projection right now. We expect that, unfortunately, as more of those death certificates are counted, that we'll see increases in some of these numbers over here. So we'll see how this goes next week, but nonetheless, overall, we expect the number of deaths to decline, and we're fairly certain on this projection, just due to the fact that deaths follow hospitalizations and hospitalizations follow infections. And so given that the infections are still going down, then we know that these fatalities are going to continue going down for quite a bit. So far, we've had over 1,100 fatalities in the Coastal Bend from COVID-19 and 703 fatalities in Nueces. So that's over 400 fatalities outside of Nueces County. This just emphasizes that it doesn't matter whether you live in Nueces or in a surrounding county where it might be less dense, less people. There's still a high proportion, or I'm sorry, not a high proportion, but about the same proportion of people in the whole Coastal Bend have died from COVID-19 as just in Nueces. There's no protection afforded by being in a county outside of Nueces with less population density. Okay, moving on to some good news, and the good news is how many people are getting vaccinated. So right now we're at about 7% of the people in Nueces County have been fully vaccinated, and if you look across the whole Coastal Bend, in Kennedy, almost 20% of the people in Kennedy have been fully vaccinated. In B County, we're looking at 13%, Clayburgh, 12.5%. So we're seeing quite a bit of the populations of the different counties in the Coastal Bend getting vaccinated. Now, what that does is that for, say, 20% of Kennedy being vaccinated, that decreases the transmission rate within Kennedy by 20%. Approximately. So that's how this works. We reported that transmission rate earlier was 0.63, and so there's a 20% discount in Kennedy off of the transmission rate we would have had without the vaccines. over the whole coastal bend, which you can see here, that discount is about 7% right now, and this number is only going to get bigger, at least for the foreseeable future, as we vaccinate more of the population. Now, if we look at the future a little bit here, we can look at how many people had at least one dose and then start to infer this is going to be the number of fully vaccinated people in the future. Right now in Nueces County, we're at about 12% of the population has received at least one dose. In Kennedy, well over 20, maybe about 25%. And you can see overall in some of these other counties, Bee, Brooks, Duval, Jim Wells, between 10 and 20% of those counties have received at least one of the vaccine doses. And when we look across the whole state and look at how the coastal bend compares, you can see that we're in the upper echelon of, these are trauma service areas for what it's worth, we're in the upper echelon of trauma service areas for the amount of vaccinations. And I think that's in no small part due to the efforts both of the local public health officials as well as hospitals and businesses and anybody that's able to get the vaccines and deliver them into people's arms. And so they should be commended for their efforts, as well as all of our healthcare community that's been helping us get through this pandemic. In summary, the transmission rate is 0.63. That means COVID is declining, and for every 10 people that contract COVID, only 6 additional people are getting infected. So the fall-winter outbreak does indeed seem to be subsiding. New cases, hospitalizations, and fatalities are declining across most of the state, although we did see a few instances of counties within the coastal bend that did see an increase over the past week. Even though the cases are down, even though hospitalizations and fatalities are declining, it's important right now to stay vigilant. You're encouraged to get vaccinated if you can. There has been a good effort to vaccinate people, but there needs to be a lot more people vaccinated before the pandemic is over for sure. Face coverings are encouraged, either double up or wear a KN95. If you're wearing a KN95, by the way, you don't have to double up. I wore one for the first time this week. It fits my face very nicely. It's very snug. There's not a lot of air leaking out or getting in. You kind of see why it's a KN95 mask versus one of those surgical masks with the big gaps on the sides and it's fogging up your glasses. If you get one of those KN95s, I guarantee you your glasses won't fog up as much. That alone, for people that wear glasses, should be motivation enough to get one. You're encouraged to social distance, and multi-household celebrations are discouraged. Now, you might think that, well, the cases are going lower. Now's the time that we can let up our guard. But that's exactly the way to let COVID get a leg up on us and start taking off again. Right now, at best, 50% of the, or at worst, I'm sorry, choose my words carefully here, but at the most, about 50% of the coastal bend has either been infected with COVID-19 at some point in the past year or has been vaccinated. So that means that half the people haven't been, and they're still susceptible to COVID-19. This is a novel virus, which means that if you haven't been exposed to it or been vaccinated, then you don't have immunity. So far, we've seen over 1,100 fatalities, and this is the type of thing that we want to stop. On top of that, we're seeing these new variants pop up, and the way those new variants can pop up is by allowing COVID, which still does have a pretty good foothold right now, allowing it to try to infect people that have already been vaccinated, allowing it to try to infect people that have already been infected before. And eventually, some of those viruses, some of those variants will hit if we give them the opportunity. But if we don't give them the opportunity, by wearing the face coverings and by still doing all these other things to try to stop the spread of COVID, even though it's in decline right now, this will help to get the numbers down and keep them down. So I encourage you to follow the CDC's recommendations, and right now, certainly everybody's still being encouraged to do these things to stop the spread, even if you've been vaccinated, really especially if you've been vaccinated, so that we don't get new variants that are resistant to the vaccines. Okay, that's our report for this week. If you have any questions or comments, you can post them on Facebook, Twitter, or Instagram. On our accounts there, our handle is at CBCovid, Coastal Bend COVID is what that stands for. So you can easily give us feedback. On Fridays at noon, we do a Q&A session live where we answer all those questions that come in on social media. We either answer them unfiltered, straight up, or if there's a number of questions that are similar, we'll address them in aggregate. And you can also tune in live on Fridays at noon to ask questions directly of us, and we'll be sure to answer as best we can. Thank you very much. I hope that you have a safe weekend, and we will see you next week.